Hi, my name is Chrisia Diaz, and this is my project on Community Mental Health Agency report. The agency in my community that I decided to call and find out more information about is the Merced County Behavioral Health and Recovery Services. They provide an array of behavioral health and support services to the population of Merced County that is living with serious mental health illnesses or substance use disorders. For the psychiatric services, typically they get a referral from a doctor or an inpatient unit, and they do comprehensive psychiatric assessments, therapy, as well as help with medication, and they provide services in an integrated format, which facilitates consultation and collaboration with all the treatment providers to ensure the very best possible outcomes for everyone. Now, for Merced County Behavioral Health and Recovery Services, services are available 24 hours a day, 7 days a week, 365 days a year, and they can be accessed either by appointment or on a walk-in basis. As I mentioned, this is for Merced County, so it is a county-operated program with county contracted agencies and other community resources. Now, their mission is that behavioral health and recovery services is committed to empowering the diverse community with hope, recovery, and wellness by providing comprehensive, holistic care, which I really thought that was a really good mission to have. In terms of the treatment approach, they do have certified counselors and licensed practitioners of the healing arts, which are LPHA. They provide direct services. They have what they call SUD counselors, so substance use disorder counselors, as well as SUD case managers that handle all the care for the population there. Services include, but are not limited to, of course, doing an intake, assessment, treatment planning, individual and group counseling, collateral crisis, discharge planning, aftercare, and referrals as well. For any needs that are identified through either the screening tools or throughout the treatment, a referral will be made to address any treatment concerns, such as physical, emotional, or sexual abuse, any other mental health concerns, and physical health problems, and they will match the patients to other resources if they don't provide those types of services there. Now, one really cool thing that I found with this agency is that they really have a comprehensive perinatal and postpartum care program. So, priority is given to women that are pregnant or postpartum, especially that are dealing with substance use disorders. And they do a lot of education, not just throughout the pregnancy, but afterwards, because they do a lot of mother-child rehabilitative services. They give them access to, educational services, as well as education and training on topics that focus the impact of substance use during pregnancy, while breastfeeding, any environmental factors that can impact the infant, and a lot of testing as well. Their educational component is either through groups, individual sessions, or they have some virtual care, some telehealth as well. They do provide confidential HIV/AIDS testing at their facilities twice per month, and all these services are free of charge. And I thought it was really cool that they focus a lot on pregnant patients that are struggling with substance use. Now, for mental health services in their facilities, they have an array of services for counseling, anger management, adult and youth counseling. They have child abuse counseling, crisis intervention. They do have a hotline um, for mental health or suicide hotline that they have at the facility. They do a lot of planning with the community and services, whether that's inpatient, outpatient care, in home services. They do marriage counseling, psychiatric case management, medication management, as well as stress management and various therapy types. For the addiction and substance use, they deal with anything from alcohol use, drug use, like I said, the perinatal substance use program, and they have as besides their outpatient, they do have inpatient and residential facilities as well. Another focus that they are doing, particularly with youth, is smoking and vaping cessation. There's a big push for young people, that are vaping, and so they are doing a lot of work when it comes to those groups to make sure that even if they're not um, using like opioids, that even if it's just smoking and vaping, they do have programs for that as well. As far as the other drug resources, they do have drug disposal sites um, that allows them to dispose safely of prescription drugs for the community. And they do have a needle exchange um, program that deals with the safe handling of needles and disposal of used syringes. So that way, they make sure that the community is safe and that patients and people have a safe and place for them to go and dispose of their used or expired medication, but as well as their syringes and any kind of needle that they would use. For the adult treatment services, it's pretty standard in terms, as I said, of all the different services that they provide. They do, for adults, is anybody over the age of 18 that are experiencing difficulties due to their use, abuse, or addiction to alcohol and other drugs. Um, for the fees, this is a drug Medi-Cal provided program, so there is coverage through them for the cost of treatment for anybody that is covered by Medi-Cal. But for individuals that don't have any coverage, they do have a sliding scale for affordable program cost. No one is ever denied services for an inability to pay. They do have a recovery assistance for teens program, which is called RAFT, and it's a multi component outpatient adolescent age between 12 to 17. Again, for the same thing for substance use disorder treatment and recovery. They do accept referrals by phone or on a walk in basis. Or with a formal referral from another agency. As far as their funding, it is the same thing as adults. It is a Medi-Cal provider coverage for the cost. But again, if individuals don't have any coverage, it doesn't matter because services will not be denied for them. Part of the meetings that there is available for the RAFT program is 12-step meetings. Um, Besides the help with the substance use disorder, they also do have a lot of education around that in family and support groups. So that way, family and parents can get involved and be part of the treatment as well. PHRS does 53.8% of the county population in terms of service. And the total served this past year by them was 5,284 residents of Merced County. And I do have the breakdown between the different ages and how many of those were serviced by them. BHRS does have a lot of data of the populations that they serve. Merced County, unfortunately, does have a high number of overdoses, particularly fentanyl overdoses. So I think that it's really good that the agency is keeping track of all these numbers, so that way they can see in the need that is in the county. As far as barriers, when I spoke to them, they let me know that they are having an issue with retainment of staff. Right now, currently, they had a position for a case manager and for a SUD counselor open, and so they've tried to do their best that they can by, for the meantime, addressing some of that, staffing issues by getting creative, meaning that all the SUD counselors will help with the care coordination gaps by offering those services themselves to the clients on their caseload, where typically you would have those two jobs done separately by two different people. So the counselors would just be strictly focusing on patient care. So for right now, what they are doing is kind of combining them until they get those vacancies, but they were hopeful to have those filled soon. They are working to reduce the wait times between the request of services and the scheduled appointments. They did struggle with no-show appointments or timeliness of appointments. And I think that was just kind of common from what they told me, just because of either people changing their mind about not being ready for services, or some of the population may be homeless and doesn't, have a way to get there on time. So they do struggle with that, but they're working with other community agencies in the county to make sure that they have kind of that outreach and those services and resources as well. Um, my personal impression, was really, like I said, just happy about all the services that are out there in the community. But at the same time, I wasn't necessarily aware of how big of a problem it was in the county. The other thing was I was really impressed by their perinatal recovery program because you don't think about that, and particularly if we are dealing with an unhoused population where we may have women that are pregnant and experiencing that, as well as, a substance use disorder, how that would be really hard. And, making sure that we're giving them the tools that they need to become successful, right? And so I just was really impressed by that program, because they also have, classes and groups focusing on improving parenting skills, mother child interaction, communication skills, and positive role model skills. So then they also prepare them to be parents and sort of how to manage that, as well as their substance use disorder. And, I think that's really good, right? So we kind of stop all these vicious cycles that we get. Um, Here are three of other community resources that are available to the agency, like the drug disposal program in the county, which is free. They also have a Narcan program where you can get free Narcan, so that way it could be utilized for somebody that's overdosing. And they have a community access to recovery services, which deals with a mobile crisis response team, a crisis stabilization unit, and also access to provide services and referrals to other agencies. Here's the information on Merced County Behavioral Health and Recovery Services. This was such a really good and important project for us to do, so that way we can see what resources are in our community. Thank you.